Basically, cancer which origins from the gallbladder is basic gallbladder cancer. So, gravity of the gallbladder cancer we need to understand. So, it is not as common as cancer as any other cancer. It is one of the rare cancer. Is not commonly seen all the population in the world also and in India also. There are some specific locations. There are some specific community in which these types of cancers are seen more common. Let's say if we speak about India, this cancer is more common in the northern areas. So cancer, which is basically adenocarcinoma of the type, it is one of the rare cancer. So it is maybe on the 10th or 11th number, all the cancers what we see in the usual population. Basically, as I told, this is one of the rarest cancer. So risk factors for the gallbladder remains the same risk factors which are there for the gallstones, what we call in a simple language cholelithiasis. So all those risk factors. So too much of fat diet. So if the patient is obese, then patient has a history of too much of alcohol intake, then smoking history, any family history of gallbladder cancer or some types of infectious diseases, and in rare chances some of the what we call some of the genetic factors. So these factors can be responsible for the developing of the gallbladder cancers as long as the patient has a gallstones, and the more attacks of gallstones. So we have seen sometimes what happens, uh, patient has gallstones, he has attack, and he just goes to the some doctor and takes painkiller and some antibiotic, and pain subsides, so he doesn't go for any surgery. Then again after that 6 months or after a year, again patient develops similar symptoms, again patient does the same thing, and such types of attacks of gallstones increases the chances. So more number of years the patient is having gallstones, it increases the risk factor for the gallbladder cancer. And the gallbladder polyp, polyp is this what we call in any, it can seen in anywhere in the body. So if the polyp is in gallbladder, if there are multiple polyps, if the size of the polyp is more than 1 centimeter, then this polyp is also can be the cancer. In simple language, we usually tell it is a commonly seen in female. It is commonly seen after age of 40 or 50, and it is seen in the fatty female. So F is what we usually tell to risk factors for the gallbladder cancers. So basically, in early gallbladder cancer, usual signs are the pain in the right hypochondrium, that is the right upper abdomen in simple language. So pain which sometimes can radiate to the back, and sometimes nausea and weight loss. This can be seen. In advanced stages, if gallbladder cancer has increased in a size and it has completely obstructed the bile flow. So basically, we need to understand the function of the gallbladder is to reserve the bile which is produced in the liver. So via liver, it comes to the gallbladder, it is a reservoir, and then it goes through via pancreatic duct to the other our bile flow channels. So sometimes when advanced stages, when the size of the gallbladder increases, sometimes it invades or infiltrates surrounding tissues, which can be the liver, which can be the other intestines and stomach. So depending on the which part they have invaded, we can see the so obstructive jaundice. So patient can have all the signs and symptoms of the jaundice, that is yellow limey discoloration of the eyes, then yellowish urination and itching and rise in the levels of the bilirubin. So this can be seen in advanced stages. Patient decreases the weight because of the nausea, and we see the significant amount of the weight loss, that is more than 10% in the last 6 months or so. And if the cancer has spreaded to the any other organs, mainly the liver or in abdomen, the patient will have unbearable pain, and which sometimes radiate to the back also. So these are the some signs and symptoms of the gallbladder cancer. I need to emphasize on a one point. So gallbladder cancer can be asymptomatic sometimes. So sometimes, let's say 1 in 1,000 cases, we see that we usually just remove the gallbladder, thinking that it is a simple cholelithiasis, that is a simple gallbladder stone, because prior investigation, what we usually do in gallstone is just a sonography. We don't do PET scan, we don't do CT scan or any other in routine gallstones. So thinking as a the patient has a gallstone, we just remove the gallbladder and we send it to the histopathology. And then histopathology report comes that it is a gallbladder cancer. So what we call this is as a incidental gallbladder cancer. So in such patient, there might not be any symptoms. So many times patients ask in such cases, patient was not having any symptoms. How you are telling or how this can be cancer is absolutely fit. Yes, in sometimes 8 out of 10 times, patient will have some symptoms which will trigger or which will trigger us to diagnose or trigger the patient to come to the physician. But sometimes in a one or two cases, it can be the absolutely silent. So, and in such thing, patients, we can see the incidental gallbladder cancer also. Diagnosis, uh, from the patient's perspective, you need to understand the gallstone is a simple disease which is 100% curable with the laparoscopic cholecystectomy. Gone those days where we take a big incision. It is 100% curable. So do not take gallstones lightly. Gallstone does not go on their own like a kidney stones. Kidney stone nikal jate hai. Gallstone does not. You need to do some treatment. So do not just put on and sit on and the weight that this gallstone will increase in size and you will have more attacks. This one of the risk factor which is in your hand. So do not do. Once the gallbladder stone or once any type of pain is there in right upper abdomen, we need to do the minimum sonography. If sonography is suggesting that it might be the cancer, then we need to do the CT scan to just to localize what is the location of the gallbladder, what are the characteristics, what is the size, whether it is infiltrating the surrounding liver, whether it has, and then finally we do the PET scan. We do the PET scan for knowing whether cancer has spread it to the which organ. Gallbladder is not the one organ where we routinely do the biopsy because there is high chances of spillage. So we don't do the routinely do the biopsy. We do the diagnostic laparoscopy. We take out the complete gallbladder with the liver cuff, what we call is the radical cholecystectomy, if it is possible. If it is not possible and all the signs and symptoms are and diagnostic tools are showing us that it can be the cancer, then we do the diagnostic laparoscopy or CT guided biopsy from the best possible point where it has the least chance of spreading anywhere else, and then we just do that confirmatory diagnosis that it is a cancer. So these are basically diagnostic tests for the breast cancer, for the gallbladder cancer. The main treatment of choice for the gallbladder cancer remains the surgery, but it depends whether the it has been diagnosed in early stage or it has been diagnosed in the later stage. Unfortunately, if these are diagnosed in the later stages or in advanced stages, usually patient is not in a state of undergoing any surgery. The patient has lost too much of weight, is a cachexic, and disease has spread to the multiple places, to the liver, stomach, duodenum. We cannot take out all these parts. So in such patients, we cannot do any surgery unless or the only thing what we can do is taking out the biopsy and confirming the diagnosis. The where one thing where we it is earlier disease, we remove complete gallbladder with the surrounding cuff of the liver also. So what we call is a radical cholecystectomy. In routine gallstones, we do the laparoscopic cholecystectomy. In cancer, we do the radical cholecystectomy. Again, this can be done openly. The my expertise, as I told, this can be done laparoscopically or robotically also. Laparoscopic radical cholecystectomy is the treatment of choice where we remove the gallbladder with the excess of liver also, and a complete cancer removal is there. Gallbladder cancer survival rate depends on the stage. Also, I forgot to mention that in a treatment, when the stage is advanced stage, when the disease is spread, the only treatment is a chemotherapy. And in the later stages, unfortunately, what we can do is only to do the palliative care. So that's the only thing what we can do. We cannot do anything to decrease the risk other than the risk factors which are in our hands. So remaining fit, not increasing the obesity, not having too much of alcohol intake, and smoking, which factors which are in our hand. Do not prolong the gallstone attacks, which keeps on coming again and again. So the moment you have been diagnosed with the gallstones, kindly go to the expert and remove it because it's a simple surgery. So these are the only thing what is in our hand. Unfortunately, it's in advanced stages. The overall survival and prognosis is not good in these patients. There is no any as such prevention other than preventing the risk factor which I mentioned. So only keeping yourself fit, not having too much of fatty food, avoiding the alcohol intake, and not going for the too much of the obesity. These are the only factor how we can prevent the gallbladder cancer. No other risk factors. Those are not in our hand basically to prevent.